Welcome to this AMCHIP webinar, signaling the public launch of learning materials and tools from the Healthy Beginnings with Title V, Advancing Anti-Racism and Preterm Birth Prevention Learning and Practice cohort. What a mouthful. My name is Andrea Cornell. I'm the Associate Director for Women's Infant Health at AMCHIP. Our agenda today is busy and features many voices from your MCH colleagues and leaders in racial justice and perinatal health. Together, we will share and explore what we learned during an 18-month cohort focused on identifying and addressing sources of racism in policy, data, and funding structures at the state level and in everyday MCH practice. It feels especially significant and meaningful to be with you today, and that you are choosing to spend time here in this space. We are all carrying with us heartache and grief and anger and confusion and indescribable feelings in the face of the Israel-Hamas war. We can't launch this webinar, which is one focused on resources related to advancing anti-racism, without an acknowledgement. We can't just continue with business as usual when this global MCH community is experiencing horrific loss of life of families and children, and all with roots in historical trauma and atrocities that are actively unfolding right now. So as we are all feeling our way forward together, I just wanted to make space for a collective breath and to extend my heart and our AMCHIP heart to you. We're with you. I'm just going to take a deep breath right now and invite you to join me. And thank you for being here and holding one another. So to further ground us in this space, as we get this webinar off the ground with you all, we'd like to give the floor to Stephanie Spencer, founder of Urban Baby Beginnings in Virginia. Stephanie is leader in Virginia and nationally advancing equity and access to high quality, culturally tailored maternal health services and support. And she led the Virginia MCH team in their participation in the Healthy Beginnings program. So Stephanie, without more delay, the floor is yours to share just some opening reflections.
Absolutely. And thank you for everyone who has taken the opportunity and time to come into this conversation during such tough times. And our thoughts and hearts are with every person that's affected, because we all are, I think, as turmoil is occurring across the nation. With that being said, I wanted to just elevate the voices of community and the work that we're doing, and that this work is hard, and it's harder when we don't have established relationships with partners from state, federal levels, and others. And what that means is that the people that we so love, our community, don't necessarily get all of the supports that are necessary in order for them to thrive. In Virginia, we have really worked very, very hard to collaborate, to bring state entities, federal entities, as well as local and regional partners together around the table to talk about this work. When I was thrust into the more of the advocacy space, and I say thrust only because though we were advocating, we were very much doing more direct service in Virginia as early childhood partners. We were moving into the maternal health space. I remember listening to our state partners in Title V, as well as others, stating that we needed to address disparities in health in Virginia and to ensure that our communities of color, more specifically Black women, had the same opportunity to have the best outcomes as possible. And we could see that there was a disparity, that women of color were dying at 2 to 3 times their white counterparts. And that was something that we all agreed what was going to bind us together for many years forward as we continue to improve outcomes. And so we've been working with the Title V teams, with Virginia legislators and others, and have accomplished so many things over time. We were the 4th state to implement doula certification and reimbursement through Medicaid. The 4th state, we were one of the states that led the charge in expanding postpartum Medicaid, and then Medicaid across the state as well, so adults would have access. there are so many other things. I don't even do it justice to tell people how many things that are occurring in Virginia. But as a community-based partner and also as a woman of color, we already know that there are racial disparities in that aspect as well, in terms of leadership and being able to lead charge in terms of making change. And so we have worked with the Title V team, and are very proud to see many of them on the phone today, and really wanted to tell you about what has occurred because of that, but also just to uplift the fact that change can happen. And it can change when you work together to build relationships. We're so thankful for AmChip and the work that they've done to bring us together in this Healthy Beginnings project, because what it allowed us to see was that there wasn't a one-sided answer to all of the complexities of things that were going on. And so we would come into these meetings over 18 months and really learn about the work on both sides of the fence, and then be able to address challenges. And then we would take that back into our organizations to continue to move forward. And the end result of that was us coming together to identify a plan of action so that we could address workforce issues in the state of Virginia related to doulas and others who are working in the maternal child health space. But concurrently, the Title V team and others were working with us to continue to elevate voice for our maternal health hubs, which provide wraparound services and support for families. When we first started, we had one hub. It was off of Blair Street in Richmond. I remember this. And then we moved. We now have 5. And that is because of the work that Title V and others have done to ensure that we are continuing to grow and address the needs of the community. We also have legislation which was pushed through to ensure that the hubs that we have implemented are studied, obviously with the intention of continuing to support families utilizing safe spaces of care, because we know we can eliminate disparities through those hubs. And then lastly, what we're really excited about is in partnership working with the Virginia Neonatal Perinatal Collaborative, which is the perinatal quality collaborative for our state, and Title V and VDH and others. We were awarded alongside of them as a partner $7.5 million over 5 years to be able to not only evaluate, create a strategic plan with the assistance of Title V, and others, but also to have partners around the table who are compensated for the work that they're doing as they're helping us to bring our work forward. That includes data and analytics, but also the expansion of Urban Baby Beginnings model to add a 5th hub, and also ensure that we have full-time and part-time employment for doulas and others that are engaged in our program. This was not an easy thing to do. It was our first federal grant we wrote. We were so excited when the Department of Health and Title V supported us in this particular venture. And the director of Office and Health and Family Services, along with the Title V director and others, were met with as we talked about what this new landscape could look like. And I think that why this is monumental and why people are so proud is because we can now see the work that we're doing together collaboratively, and we can see it in action. And so although I don't know how to do the round of applause thing where you put the flags up, I want to give a round of applause to our Title V team in Virginia, to AmChip, to our Department of Health and other partners. And I want to say thank you, thank you, thank you so much. And I also want to remind people, don't give up, because I can tell you, I can just remember being a nurse, just doing the work, and being thrust into this space has allowed me to open my eyes and see other things from a different perspective. And that relationship that you build with others really matters. So keep building relationships. Keep working with community-based partners. You're going to see so much more come out of it. And not only are you going to feel more supported, you're going to feel like you're making those changes in your communities so that they can thrive as well. So thank you for giving me the time to share and to talk with each of you and to share our heart and our love. And we hope that you all continue on with this great work and that we'll continue alongside of you.
I don't want to pivot too fast away from that. That deserves a breath, a moment. Thank you, Stephanie. That means the world in all ways. That's phenomenal. Thank you. I think so many of us at AmChip and on the line would love to respond to your remarks and share how much they mean to us. I'm going to pass the floor to Carolyn Stanfill, our Chief Program and Strategy Officer, to share some remarks briefly. And I think they're a wonderful follow-on to what you've shared and what this has meant to us at AmChip. So Carolyn, I'll pass it to you.
Great, thank you, Andrea, and thank you, Stephanie, for those remarks. I'm so delighted, my heart is full to join you today to express how significant and transformational this project has been for AmChip. And I want to take a moment to thank all of my beautiful AmChip colleagues who really put your brilliance into this work. There's so many people behind the work. The Healthy Beginnings program is an example of how AmChip is living our values as a bridge for change. The work really intentionally started with groups of people in communities and state governments who wanted to change the status quo and who were ready to embrace the opportunity. Embarking on work like this means that we ask everyone to lean into being uncomfortable. When we acknowledge that we have to change the status quo, we're also acknowledging that we might be part of the problems and we might be deeply ingrained in the structures that hold those problems in place. And that can be daunting. We had 6 teams who signaled that they were ready for things to change, and they bravely tried lots of new things. Governmental public health was led by community-based organizations throughout this process. And that's a power shift, a structural shift, and a mental model shift. And AmChip is honored to be the bridge for that work. So today we celebrate the fruits of those efforts, and we're excited for what's ahead. So thank you all for being here today to learn and share within our community. And I hope you come away inspired and emboldened to challenge your status quo.
Thank you so much for that, Carolyn. My name is Jake Mulroy. I am a public health associate on the Women's and Infant Health team at AmChip, and I had the privilege to be a part of the Healthy Beginnings Learning and Practice cohort. My teammate and I, Salome, are going to walk you through a little presentation about the history of the cohort and how it came about and sort of the cohort structure. So the cohort started in 2020 based on 3 issue briefs that were developed by AmChip and a national meeting that came together with thought leaders. And it was funded by the Pritzker Children's Initiative and the W.K. Kellogg Foundation. And the full title is the Healthy Beginnings with Title V Advancing Anti-Racism Preterm Birth Prevention Project. And this was an 18-month learning cohort that ended in December of 2022. And it brought together 6 Title V MCH agencies and 6 community-based organizations who are residing in those states. And we paired them together to build transformational relationships to identify and address racism in policy, data, and funding structures at the state level that sustained inequities in perinatal health. On the left, we have a graphic by Rio Holiday, who is our graphic designer throughout this project, and she created some amazing graphics that you will see through this presentation as well as on the website. So there were 4 strategies in this cohort. The first was around data, and it was to ensure perinatal and social determinants data are inclusive, relevant, and accessible to all stakeholders. The next was investing in comprehensive perinatal data systems for states and community-based organizations. The third was to cover the cost of necessary supports to prevent preterm birth with public and private funds. And the final was to restructure Title V funding requirements to support community-based organizations and interdisciplinary perinatal providers with an anti-racist, equity-centered reproductive justice framework. And throughout this learning cohort, the teams each month met, and we did a learning session where it was things that the cohort wanted to learn about more, or it was things that we had already wanted to cover. And in February, which was about halfway through the cohort, we had a 2-day, all-day session, and that was to basically bring the teams together and for them to come up with an action plan. And the action plan was surrounding one of these 4 strategies. And all 6 teams created wonderful action plans that some are still working on even today. And the whole goal was to create this relationship between the community-based organizations and the Title V MCH agencies, and we think that's exactly what this cohort did. There were 6 teams, as I mentioned. The first was the Alaska Native Birth Workers Community and Alaska Title V. Next was System Midwife Productions and Louisiana Title V. The third was Minnesota Indian Women's Resource Center and Minnesota Title V. The fourth was Healthy Start, Pittsburgh and Pennsylvania Title V. Urban Baby Beginnings, which Stephanie is a part of, and Virginia Title V, and finally Roots for Change Co-op and Wisconsin Title V. So all 6 of these teams came together. Some of these teams had never met their state partners before. Some had a previous relationship, but they all came together and did an amazing job on this cohort and created wonderful action plans and inspired us to create these learning bundles and to share them all with you. And I'm going to turn it over. Nope, sorry. I also want to introduce our steering committee who helped us plan some of these learnings as well as these learning bundles. So we had Jody Arnold, Twyla Dillon, Azanet Hari, Janelle Palacios, who you will hear from later on, who helped work on anti-racist data modules that the EE team at AmChip developed, the epidemiology and evaluation team. We had Michelle Schulte and Zainab Suleiman, and these 6 thought leaders and subject matter experts were influential in creating this cohort, and we wanted to thank them so much for the work they've done. And now I will turn it over to my colleague Salome, who will run through the cohort structure with you all.
Yeah, thank you, Jake. So, and just hearing about what everyone has shared so far, when AmChip came and developed this cohort, one thing that we did was that we hosted cohort activities that were synchronous and asynchronous, which means that sometimes we had sessions where we just wanted teams to just focus on their state team action planning. And so having sessions that were in real time, based on some of those curriculum topics that are shared on the screen. We provided trainings around those curriculum topics, but then we also had sessions where we asked folks to kind of meet outside of these sessions and work on their action planning. One thing that we were really intentional about was providing compensation for community thought leaders, for the community rooted and community based organizations to engage with and invest with their organizations. And so we really were just thinking about, how, and thinking about Title V's role. This is something that is a part of their role, right? And thinking about community partners, we were very critical about including compensation for them, especially because Title V members were already kind of being compensated for this. This was kind of a part of their role overall. And so creating equitable compensation, I think, was something that we saw was very critical, and even just developing the cohort overall. And so some of these curriculum topics are ones that we'll explore today as well in our Healthy Beginnings learning bundles later on. So Rio, she developed a lot of beautiful graphics for us. And one of the things that we did at the end was just coming together and really thinking about, what are some of the lessons learned and how can we kind of create this into a visual to share with folks. And so one of the first things we did was thinking about what were the elements of successful relationship development in this. During the 18-month period, we really focused so much of our time on building the relationship because we saw that that was really crucial and critical in even getting to what the action planning will look like. And so on AmChip's side, building the cohort really involved holding space and time and really being transparent about the unknown. We were very transparent that this was kind of our first experience with this, and that we really wanted it to be led by the members in the cohort. And so providing clarity and communicating the process, creating group norms that really honored the lived experiences, they honored the community thought leaders, they honored the members from Title V that were participating. And like I said, really creating equitable compensation and flexible funding for community-rooted organizations was something that we saw as critical, and even developing and building that relationship. And then another thing we saw was that in order to shift power dynamics between organizations, because this was something that was being led by community leaders, it was important for Title V to really understand what the internal racial equity commitment was, and really consistently showing up and being present every time That was something that we saw as necessary in even developing a meaningful relationship, and accepting community-rooted organizations, like I said, as the decision makers, and being open to reflect and really being creative in thinking. And so in this image, you see that both sides are kind of meeting towards the middle, meeting towards the sunset. And that is the relationship building that we saw, which was 4 key elements, which was being transparent, having trust, active presence, and really being patient and having time. I think that that was something, having the cohort designed the way it was something that was really beneficial to both members, because it provided a time and a space for folks to meet, and also just being patient about the ways in which the action planning could take place. Next slide, please. So one of the things that we'll be discussing today, even, and you'll see in the Healthy Beginnings learning bundles, was that we noticed and recognized that the essential skills for Title V, to even just start thinking about how they could work and build long-term relationships with community partners, was that it included providing trust building. It included removing harmful language, whether this be removing harmful language from their programmatic activities, from their own communications. It really was crucial in developing a relationship, was that there was no harmful language. There was a space where community thought leaders felt like that they could have a space to be heard. And that really involved protecting the intellectual property, which is something that we were really excited to work on, and it's something that we'll share a little bit more about later on. And then we had presentations on recognizing the impact of anti-Blackness on the competition of resources, really having Title V identify their power dynamics and power sharing, and prioritizing data sharing and data inclusivity was really a couple of key elements and skills that we recognize. But we also recognize that the journey goes on, right? And even as after the 18-month period ended, just hearing about how folks were able to really develop one-on-one relationships within their states was something that was very, it was really great to hear and very exciting to hear, because it meant that they were able to create relationships that will go on even after AmChip kind of stepped back in and allowed them to develop their own relationships. So overall, the impact, when we first started this, we realized we had a couple of things that we kept in mind, and we were very intentional about kind of removing, which was that we often heard that relationships between Title V and community-rooted and community-based organizations was often transactional. It was often one-sided. And then there was also just kind of this competitiveness between resources within the community. And so we were very conscious of these things, and we wanted to make sure that in growing that we were removing these elements, and that relationships weren't going to be built on this foundation. And so another thing that we saw was that there was just limited access to data and other elements to share power. There was really a lack of acknowledgement of the trauma that communities were already experiencing when it came down to working with state agencies or state health departments. And then this is the lack of the 3 C's, which is something that we created when developing curriculum around protecting the intellectual property of community partners, which was compensating, citing, and celebrating the work and the intellectual property of the leaders that were present. So overall, with that, we saw that, you know, growing with the Healthy Beginnings meant that we had to have an opportunity to see the power and the role of MCH programs through the eyes of community partners. Having them lead this initiative was something that was really eye-opening, I would say, for Title V side. And it really kind of brought in a sense of comfort and emergence into allowing action planning sessions to really be built on things that were going to be very beneficial to both groups. And so putting the relationship first, like I said, that was the main foundation of Healthy Beginnings, was sticking to how we're going to build this relationship, and acknowledging really the racist historical practices that were already taking place was crucial into really even going into identifying practices and policies that can be reshaped within Title V agencies. And then, like I said, just including those 3 C's of compensating, citing, and celebrating the work that was being created. So I just want to say a special thank you to the 6 community partners that you see on the screen. as well as the 6 Title V teams that were participating in this, because they really allowed us to develop all of the curriculum that you're going to be hearing about today. And they allowed us to really see where and how AmChip can be a support when it came to bridging the relationships between community thought leaders and states. We also want to acknowledge the steering committee members, because they really helped us in even thinking about, where can we start when we think about some of the feedback we were hearing and developing some of the curriculum. They really allowed us to see where we could start, and provided us with a lot of subject matter expertise around it. And of course, we want to thank our funders, Pritzker Children's Initiative and the Kellogg Foundation, who've all supported and made this cohort possible. And so I'm going to pass it now to Jake to share a little bit with you the exciting part, which is the learning bundles that were created during this time.
Thank you, Salome. I am going to walk through our new website that's housed on AmChip. But before I do that, we are going to have speakers from the Virginia Title V and later on from the Louisiana Title V. But first, I want to introduce Jen McDonald from the Virginia Title V, who's going to talk about their experiences in this cohort.
Hi, everyone. Thank you. My name is Jen McDonald. I am the director of the Division of Child and Family Health here at the Virginia Department of Health, and our division oversees the administration of Title V and MCH. And I want to say on behalf of the Virginia team and the Title V team, I want to thank AmChip for the opportunity to participate in the Healthy Beginnings Learning Collaborative. It really was one of a good reflection and meaningful engagement for the team. And I want to say thank you, Stephanie, for your kind words earlier. We really appreciated your time and energy into the collaborative, and we really look forward to continuing the statewide work with you. Congratulations on receiving the grant funding. It's very exciting for Virginia, and we're in agreement that relationships and transparency have been and continue to be key in moving the work forward. So we learned a lot in our conversations with you and with the other participants in the collaborative. In addition to having the frank and vulnerable conversations with other partner participants and our community-based organization with Stephanie and Urban Baby Beginnings, one of our outcomes for our Title V team was digging in deep and taking a look at the use and harm reducing language in all aspects of our program, education, literature, grant writing, websites, etc. You name it, we've been looking at it. And basically our usage or lack of usage of inclusive language. And so the resources shared during the experience were very valuable to us. One particular resource shared was the CDC's Health Equity Guiding Principles for Inclusive Communication, and then the supplemental AmChip Summary of Key Terms and Principle Guidance, which I don't know if anybody can put a link to that on the chat, but I have it right here. It's very close to me at all times. For me, it sits, like I said, sits right next to me in the office. This is now becoming second nature to my thinking and writing as I refer to it over and over again. And I just wanted to give a couple of specific examples where we have utilized the resource. And so primarily the phrase "at risk" has been written and spoken in many venues throughout our programs, and we now understand the stigmatization that it may bring. And we have noticed this and now use the terms that are listed on the guidance, but really take them to the heart: disproportionately affected, under-resourced communities, etc. And the federal maternal infant early, I'm going to say MCV. Sometimes I get my acronyms a little mixed up, but maternal, infant, early childhood home visiting staff have incorporated SMARTY goals, the strategic, measurable, ambitious, realistic, time-bound, inclusive, and equitable goals for state programs to implement and report on. So for instance, one of the goal objectives was by September 29, 2023, continue to assure the availability of evidence-based home programs, home visiting programs to at least 1,200 in 1,200 families in at-risk communities annually. And so that had been changed to say, continue to assure access of evidence-based home visiting programs to those 1,200 families in communities that are underserved with limited access to home visiting services in their community. So even though that has occurred, there have been some challenges where the federal MCV team still uses disjointed language in some of its guidance, and so they still use at risk. And we do understand that this takes time, and organizations are still grappling, for lack of a better term, or working to use better terminology. So we did, as a program, report this to our federal funders, which in and of itself can be unnerving to do, but also know that speaking up is absolutely needed in this space and critical to moving the needle forward. The last example I kind of wanted to share in our harm reduction language strategies is that Consuelo Stan, and I think she may be on the call today. She is our Resource Mothers Program and doula certification program coordinator. And Resource Mothers is a home visiting initiative or program that serves pregnant and parenting teens. And Consuelo took the guidance that we have been given and searched through all of her documents and all of her programs to find the terms to avoid and replace them with the appropriate terms. And so, for example, she incorporated the phrase pregnant and parenting teens and their infants to replace teen mothers. So these are just a few of the examples, and we're very dedicated to continuing these changes. And so the challenge is that the team often finds itself in an environment where we find ourselves in vulnerable positions with political climate. And sometimes the need to pivot from what we learned in this collaborative and what we know holds true, we may have to pivot that to move our work forward. And that puts us in a very vulnerable situation, but we continue to advocate and hold true to our values. And so really want to thank again the collaborative, AmChip, Stephanie with Urban Baby Beginnings for really letting us participate. And thank you.
Thank you, Jen, for that. I am now going to run through our website. So let me share my screen, and hopefully a team member of mine can pop the website link into the chat and everyone can explore at their own pace. And after this meeting, you all can check it out. But basically, the way to get to it is to go to the AmChip website. You can go to topics, scroll down to maternal and infant health. And if you scroll down to maternal and infant health, you will see, hovering over it, you will see Healthy Beginnings, and you can click on that and it'll take you to this web page. So at the start of the web page, we have an overview of the cohort, which we spoke about. We had the cohort aims. On the left, we have a drop-down menu of things you can click to meet the steering committee, meet the community-based organizations, go right to the learning bundles and data modules. You have a contact us page, but it's all housed on this singular page. So here you have the learning bundles and data modules. So you can click on any of these, and I will be going over some of these, but you can click on the harm reducing language one that Jen brought up, and you'll be taken to a page that has, some of them have a presentation, they all have discussion guides, they have resources, slide decks, they all have everything you should need. And upcoming soon will be our Deconstructing Racism and Data modules, which Michaela from AmChip and Dr. Janelle Palacios will speak about later. And if you keep scrolling down, you can meet the community-based organizations. You could click on any of these and be taken to their websites. They are all very open to speak about their experiences and the resources that they have. You can meet our steering committee and click on these to hover over new people to meet. And finally, you have a contact us page at the bottom. But I'm gonna quickly switch over. So this is what happens when you click on one of the learning bundles. This is the harm reducing language one. So you have a video you can watch. You have a brief description of what the learning bundle is. You have objectives of the learning bundle. You can click on the presentation slides. The glossary and the inclusive language guide that were shared in the chat earlier can be accessed. You can also request technical assistance from AmChip. We would love to help anyone and everyone who wants to learn more about these topics or is struggling with them. We would be happy to meet with you and talk through all of these learning bundles. We also have our Protecting Community Intellectual Property learning bundle. And on this, it's not a presentation, it is a slide deck, and you can learn about intellectual property. It was something that came new to AmChip, and it was an amazing experience to work through what intellectual property means and how important it is to community-based organizations. But here we have recommendations to protect intellectual property. We have an infographic. We gave a presentation on it, and we have more technical assistance. So if you need any of those things, you can find it all on this new website that is, we are so happy to launch. It was launched officially yesterday, and we are delighted, and we hope everyone can use it and participate in it. And another one of the learning bundles, I'm going to scroll up real quick, was Power Dynamics. And Power Dynamics was a very important aspect of this cohort, with community-based organizations sort of leading and taking more of the power role that is typically accustomed to the Title V MCH agencies. And I want to queue up Dianca Pierce and Becky Madoc from Louisiana Title V to talk about their experiences in having a community-based organization lead them in this cohort process.
Thanks, Jake. And many thanks to AmChip for the opportunity to participate in the Healthy Beginnings program. My name is Dianca Pierce. I'm one of the managers in the Bureau of Family Health. The Title V program is administered through the Bureau of Family Health here at the Louisiana Department of Health, the Office of Public Health. And so, as Jake mentioned, we've been asked to talk a bit about the power dynamics of the cohort from the perspective of Title V in Louisiana. As a state agency, we are accustomed to being the people at the table considered the subject matter experts. As you could imagine, we're accustomed to providing expertise on maternal and child health data, activities, and more. But in the case of the Healthy Beginnings program, the power dynamic was reversed, and we were the receivers of feedback, receivers of ideas and of experiences. We worked with System Midwife Productions, which is a birth advocacy training and consulting agency. And they were able to really guide us by sharing the real life experiences of a CBO in trying to access our resources and the roadblocks that they encountered while trying to do so. And so it was great having a CBO guiding us through this process and helping us to shape our direction for the future. The process was enlightening. It offered the opportunity for us as a state agency to actively listen to the needs of the CBO, and then as a team to later reflect on how we could effectively respond and build equity and accessibility into our data processes and our data products. System Midwife Productions was able to specifically identify a data need that they had. And unfortunately, the need put undue hardship on their team actually to fulfill it due to the inaccessibility of our resources. And so through this process and through our meetings and our plannings together, we discovered several opportunities. And I'll talk a little bit about each of them. And the first actually was an opportunity for us as Title V to educate our own staff about the availability of our data located in our online data center. And we needed to educate our staff so that they are able to effectively communicate the availability of data to internal and external partners. our CBO had felt that they, in certain situations or with in front of certain health department staff, they had already requested our data, that they felt like, that they were not directed to available resources and available technical assistance. And so again, that highlighted a learning opportunity for our staff. Secondly, we discovered an opportunity to improve data accessibility through modernization and self-serve analytics like dashboards, and to work with our internal partners here within the Department of Health to centralize the location for requesting our health department data. Our partners do not see us as an organization that is separated by centers as we are, and then further separated by bureaus. They see us as the Louisiana Department of Health. And so again, the opportunity to centralize our request process was definitely highlighted through the Healthy Beginnings program. And then thirdly, we saw the opportunity to revisit the data products that we produce. We currently produce annual reports of our data. And so we're looking at perhaps expanding that and diversifying our reporting to maybe special reports and fact sheets. And then also to consider reporting or disseminating our products on a more frequent basis. And so again, these were the opportunities that were highlighted. And I'll hand it over now to Becky to kind of give a nod to how we're going to proceed in the future as we continue to implement these learnings that we gathered through the program.
Hello, everybody. I am Becky Madoc, and I am new to the role of Data to Action Team Lead for the Bureau of Family Health. And so I'm coming into this project on the back end. I was familiar with it in my previous role, but I wasn't intimately involved in it. So I'm really excited to be able to be in charge of the team that's ensuring that we use these learnings from Healthy Beginning to inform and shape our future work when it comes to our data and our data systems and moving our data to action. I'm happy to share that we've already begun the work within our Office of Public Health to get some of our key maternal and child health data indicators onto self-serve dashboards. We're in the process of cleaning up some data. We used to publish these MCH data profiles by parish and put them up on a static website, and they were hard to find if you didn't know where they were. Now we're working with our Bureau of Health Informatics to actually get them live and self-serve. So that's exciting, and we're almost there. And we're also working within the Office of Public Health to make a centralized location to request public health data, because like Dianca said, they don't know the Bureau of Family Health from the Bureau of Health Informatics, from the Bureau of Vital Records, and anything else within the Office of Public Health. They just know that public health has data and need to use it. So we are working to centralize the data request process and make it more uniform across the Office of Public Health. And we're hoping to launch all of this by the end of this year, beginning of next year. In the Bureau of Family Health, we've also started making materials to support our data reports that we put together, pull out topic and specific information, and try to make it more accessible. Things that we can include in social media, making social media toolkits for other people to put out there, making talking points and quick overview fact sheets instead of having to read a 37-page long report to understand what we were trying to tell you that was important to do. So we have a long way to go. And there's still a lot more that was identified during this this opportunity that we still need to implement, but I think this is a great start and we're looking forward to it. And we thank AMCHIP for this opportunity.
Thank you so much, Becky and Dianca. That's so exciting for all the changes Louisiana is making. And it's a perfect segue into our Deconstructing Racism in Data modules that Michaela Fry from AMCHIP and Dr. Janelle Palacios, who is a steering committee member, have been working on, and they're going to introduce and talk about them.
Thanks, Jake, and thanks, Becky, for that wonderful cue up. I'm going to start sharing my screen. All right, is that good? Perfect. Okay, so as a complement to the learning bundles that Jake and team have shared with you all, myself, Dr. Janelle Palacios, Dr. Cheryl Clark, who's also on this call, and the Associate Director of Epidemiology, Evaluation and Metrics at AmChip, and Dr. Dodie Arnold have been working for the past 2 years to create this content for our data module series called Deconstructing Racism in Data, otherwise known as DRID. We love a good acronym around here. So what is this? What is DRID? It is a training module developed by MCH experts, including the work group that I just mentioned, and then also everyone who was involved in the Healthy Beginnings cohort and collaborative. This was really a collaborative effort, and we would not have been able to create this content in a way that honors them and the maternal child health workforce without their input and continued dedication to Healthy Beginnings. So we really appreciate you all. It is aimed at improving equity in perinatal health data and deconstructs racism in data by investigating the root causes of racism in data and how that has shown up throughout centuries, identifying how racism presents in data, identifying how racism shapes practices, policies, and narratives, and then also exploring a few solutions for how we can move forward and continue our journey on decolonizing and making data more anti-racist. We decided DRID was needed. It was part of the learning bundles, and the modules were developed at the start of this project. There was a need for them to do two things: to guide invested parties on the self-awareness of power dynamics between partners, especially between state-level partners and community-based partners, to equitably engage communities and equitably share power, which we've heard testaments of from the folks here today, and also have seen that play out in our Healthy Beginnings cohort. It's also meant to cultivate equitable power on data sharing, evaluating programs, and decolonizing research. And I'm just flying through these. Apologies, we have limited time today. Some of the activities and information gathering that went into developing DRID are here on this slide. So because these modules were developed in the context of a cohort where interrogating, shifting, and disrupting power dynamics between Title V agencies and community-rooted partners was focal, those questions around equitably engaging communities and framing communities positively were front and center here. And so while these modules will be relevant, relatable, and accessible to the entire maternal child health and public health field, the modules had the initial intention of being a resource for deconstructing racism in data, especially for Title V. And thus we wanted to conduct our own needs assessment with the state teams that Jake mentioned and has showcased, that included assessing the existing power dynamics and the data relationships within the state teams, the resources and equitable data practices that Title V agencies were currently implementing, and barriers that they were facing, and how the community-rooted partner has felt that they have been included or excluded even in the state's data practices, particularly around data sharing and accessibility. So these questions that we wanted to get at really came from these 5 different activities that we did. So we did cohort sessions, which were really important for illuminating some of the relationships between the Title V team and the community-rooted partner. We did data interviews with each team. We got some information from evaluation and assessment. And then also to create the modules, we had monthly meetings with the DRID work group, and then did some more research and content development. So an example of some of the questions and activities that we did to gain some of the information to inform the creation of the DRID modules was during one cohort session where we talked about power and data, and we just asked the whole cohort 3 simple questions. Where do you access data? what data would you like to access, and what would help you access the data you desire? From these questions, we did gain a lot of information on where states and community-based organizations are getting data that wish they had, and what they need to get the data they wanted. And some emerging themes included desiring access to community-driven and owned data, cultivating stronger state and community partnerships, utilizing and promoting storytelling and qualitative data, and more accessible and consolidated data access points. And so these big themes really did inform the structure of the DRID modules and the content that we decided to showcase here. I'm going to skip this slide and just show you a little bit more that went into creating the DRID modules. So the DRID work group, we've done monthly meetings since October of 2021. We sent out an RFP for an e-learning module developer and selected a developer that has been helping us consolidate all of these into a website, which is really great. And then bringing content to life, we've been working with this developer for the past several months, and finally have some content to show you today. So we'll get to that soon. And I just wanted to share that we did create a logic model for these modules with two really important medium and long-term results that we wanted to come from these modules. One being that participants or learners will incorporate best practices for framing communities positively and using a strengths and assets-based approach to framing communities and data, and then to shift power and data back to communities. So the module topics that we have are the history and legacy of exclusion and racism in data, ensuring anti-racism in data and anti-racism and equity in the data lifecycle through all of the stages, and then honoring Indigenous data. And I will actually stop sharing my screen and then pass it over to Janelle to give us a brief walkthrough over the module honoring Indigenous data that she has created for us. Thank you for staying with me through that very quick overview, but I'm very excited to get these out.
Thank you. I'm very honored to be here. And I just want to say that it is a special honor to be able to work with the AmChip team, because they are just a lovely group to work with in general. And I've created some really deep friendships. So I just want to say thank you. And especially thank you, Cheryl Clark, for inviting me and inviting me to the Healthy Beginnings space. Let me also just say that creating modules is a whole new skill set that is very intense when you're really trying to do them professionally, for sure. So the monthly meetings may not sound like much, but it's really intensive to do this work and to kind of concisely drill down the important things. So I will just share that in this module, we're sharing two modules. The first module, which is how data became exclusionary, a historical context. And we have a voice, there will be a voiceover that will be shared during this. And so people can click the voiceover as they want, or they can read it without the voiceover. And we try to intentionally have some engagement where there is some clicking, with the acknowledgement that we were also trying to be open to people maybe not being able to click or maybe not being able to take that information in. So we were trying to really think about all the people who would be able to use this, this module. So every module starts with a set of objectives. And here is a sneak peek at just discussing what racism is. So we just ground it very upfront about racism, about systemic racism, structural racism, and the influences of racism. We have like an example of a real world impact. So how data can be, how research and data can be racist. So for example, in the birth world, I'm a nurse midwife, and just until recently, Race was a category in the vaginal birth after cesarean calculator. So for every person who had a C-section, they were then counseled with their providers whether or not they would have a success rate for a vaginal birth after a C-section. And this is really important because a C-section, the more C-sections someone has, there are more health effects for their life and their infant's life long-term. So it's really great. It's optimal to have a vaginal birth. And race was used as a deterrent for Black women in general. Black and Latino women had higher rates of less successful vaginal births, according to this calculator. So providers were counseling women of color that they probably shouldn't be trying a vaginal birth. So this is just one big reason or one example of how race is embedded into our research. And it turns out that it's not biological race, it is racism that has these deleterious effects. So this is an example of how racism is insidious in the work that we do in the data collection and data dissemination. Every module has their own knowledge test. As you can see here, we try to make it different. So there's true, false, there's matching. We were trying to make it a little bit entertaining and fun. We have a special module, Module 8, Indigenous Data and as a deserved focus, just because the American Indian Alaska Native population as a population and how we're counted and the history of why we're such a small population needed some specific information for people to understand. So we do have this module where we talk about a COVID-19 example of really states were not collecting data on American Indian Alaska Native people. I bring people through a very short historical and political context where we talk about the doctrine of destiny, divine design and cultural superiority, basically how the political system engaged American Indian Alaska Native people and shaped the value of who they were, as well as some things about giving up land, being put on reservations through treaty rights. And we go into identity, which is a big thing that many, many people do not really know about. I'm going to end right here so that we can maybe come back to some questions. I will just say that my voice is recorded for the last module, Module 8. And we are still shaping up the rest of the modules, but this is just a sneak peek to share with you the importance of this work. Dianca shared something, a phrase that there's an importance of shifting power dynamics, and that is exactly what we're trying to do. So this module, along with the other tools from the AmChip website, are going to be really important in shifting power dynamics for the world to come. Thank you.
Thank you so much for that, Janelle. These modules look amazing, and I can't wait to check them out when they are fully finished and published. We are coming to an end, and I want to thank everyone who was able to attend and be a part of this webinar. We would be happy to answer any questions you all have. We're going to launch a poll/survey just to ask how you're going to use these resources, but please feel free to ask us any questions you have right now too.